Depression and chronic pain are two conditions that often go hand in hand. There are multiple reasons for this I cover in my videos. Mental factors go along very closely with physical ones, and both influence depressive symptoms as well as the experience of pain. In this video, I will talk about some of the psychological processes that lead and entertain depressive symptoms and worsen your pain experience. Just as a short recap for you, what do we talk about when we talk about depressive symptoms? The diagnosis of depression is marked by feeling depressed, sad, a lack of drive, a lack of self-worth, suicidal thoughts, feeling guilty, sleep problems, a lack of concentration and sometimes memory, just to name the most important ones. Please bear in mind that depression can be a very serious disorder. So if you know the above symptoms, please turn to your doctor for help. For here, let's start with the first important process, learned helplessness. Learned helplessness is a concept that Martin Seligman discovered when he researched the factors that contribute to depression. It describes the belief that you have no control over your circumstances. This can lead to feelings of helplessness, withdrawal, and eventually even depression. It is something that a lot of people suffering from chronic pain know. Having tried so many things to get rid of the pain, and most of it, or maybe all, didn't work out. This leaves us helpless, and we don't know how to handle our situation anymore. Eventually, this might lead to withdrawal, hopelessness, and a loss of self-worth. Since this is such an important topic, I already made a video on it. You can find it up here. Pain, depression, and the lack of positive reinforcement. Over the course of the journey through chronic pain, lots of people lose friends, sometimes their work, hobbies, and start to withdraw from many areas of life. A lot of what makes life worth living seems to be lost. This is what we call a loss of positive reinforcement. But we need this reinforcement to live a life we can value. If this is not given, depressive symptoms tend to show up. In this case, they are like a warning signal that tells us, hey, something's wrong in your life here. Furthermore, what happens when we withdraw from our hobbies and social contacts? We get lonely, don't we? And when we are lonely and suffer, our mind usually doesn't come up with the most vibrant and exciting ideas. Mostly it revolves all around our misery, our pain, around what didn't work out and how difficult the future might be. So to get new ideas, positive reinforcement is utterly important. Actually, one of the most healing and helpful things we can do is building up new activities we can value. Something we can value in our life, maybe picking up old habits or relationships as far as possible. I know this is easier said than done. Often enough, we need someone from the outside to help us with it. How depression reinforces pain. It is not only that long-standing pain can lead to depression. It's also the other way around. Depressive symptoms can feed into the pain. How does this work? In most cases, depression looks only passive from the outside. Inside most people, there are a lot of unpleasant thoughts, emotions, and sensations going on. All this can be highly stressful, and this stress feeds into the pain, making it worse. I already made a video on stress and pain. You can see it up here. Pain shows up only during a depressive episode. Now that we talked about how chronic pain leads to depression, let's take a short look the other way around. Because it's not uncommon that you might suffer headaches or belly aches, sometimes an aching bed during a depressive episode. The mechanisms behind it aren't very well understood up to date. But two things can be taken into consideration. First, there may be some slight inflammatory processes in the body during the depressive episode. And secondly, depression is accompanied, at least in most cases, by a heightened level of stress and tension. If this goes on for a longer time, it's likely that the alarm system for pain is also triggered. Usually, this kind of pain vanishes when the depressive symptoms decrease. If it gets too much during the depression, I'm certain that your doctor can also help you with the pain. In this case, we usually don't speak about chronic pain, and it normally will be treated more like an acute pain. But as I said, for this, it's utterly important to talk to your doctor about it. What to do now? As I promised in the beginning, I will now tell you some ways that can lead you out of this dilemma. I know that I didn't touch all the causes of chronic pain and depression, but for the length of the video, I want to conclude here. First step, get a good pain treatment. Sincerely, this is essential. Since the late 80s and early 90s in the last century, we know that a combined effort of specialized doctors, psychologists, physiotherapists, and sometimes social workers can get the maximum result for you. If it's possible to lower the pain to a level you can stand while getting more active again and learning how to deal with the pain and the circumstances of your life right now, it's a good way not only to tackle the pain experience but also the depressive symptoms. The best is when all of the therapy goes on in a setting where the therapy is coordinated. We call this an interdisciplinary multimodal treatment. I know in most countries this form of treatment is very rare, but maybe it's right around the corner. The next best thing is to have all these things separately. And if there's no possibility, get social support by a self-help group. Yes, they are the next best thing. Even if you go to therapy, self-help groups might be really, really helpful for you. In general, the first step is always to be informed. So don't stop here. In this video here, you find more about how pain influences depression. And here you can find out how pain is a lot more than just a sensation. For the right treatment, it's so important to get a broader view. So happy to see you there.